there is a moment that most people over 60 have experienced. You are sitting in a waiting room under fluorescent lights, a paper gown crinkled beneath you, waiting for a doctor you might only see for 7 minutes. You came because you were told to. Someone, a friend, a family member, a pamphlet in the lobby, told you that getting checked regularly is simply what responsible people do. You believe that. You have always believed that. Taking care of yourself is something you take seriously, maybe more seriously than anything else in your life right now. So you show up, you get the tests, you wait for the results, and you assume that more information always means better protection. But what if that assumption, one that millions of Americans over 65 carry without question, is not always true? What if some of the very checkups you are faithfully attending year after year are not protecting your health, but quietly complicating it? What if certain tests that were designed with the best intentions are for people your age and at your stage of life, creating more fear, more risk, and more unnecessary treatment than they are preventing harm? This is not a conspiracy. This is not someone trying to keep you away from doctors. Is medicine catching up with itself? This is the science of aging finally being honest about what works, what doesn't, and what the numbers on a lab report actually mean when you are living inside a body that has been through 60, 70, or 80 extraordinary years. Medicine was largely built on studies conducted on younger populations. For decades, the thresholds, the normal ranges, off numbers used to diagnose disease and trigger treatment were calibrated for bodies in their 40s. And when those same standards were applied to people in their 60s and 70s and beyond, something strange happened. People started being treated for conditions they didn't really have. People started taking medications for numbers on a page rather than for actual suffering. And in some cases, the treatment caused more harm than the original finding ever would have. I want you to picture something for a moment. Imagine you are holding a map of a city you have never visited. The map was drawn 40 years ago. Some of the streets have changed. Some of the buildings no longer exist. A few of the roads now lead somewhere dangerous. If you follow that old map without question, without updating it with what you now know, you might end up lost, or worse, somewhere you never intended to go. That old map is what medicine has been using when it comes to certain screenings for older adults. And today, we are going to look at that map very honestly together. Now, before we go further, I want to be clear about something important. What you are about to hear is not about skipping medical care. It is not about trusting your gut over your doctor, about becoming the kind of informed, empowered patient who walks into that exam room with real questions and who understands deeply what each test is truly for. Because when you understand the why, everything changes. You stop being a passive recipient of medicine and you become an active partner in your own health. And that shift, that moment of truly understanding your own body and what it needs, is one of the most powerful things a person can do at any age. So let us begin with something that surprises nearly everyone who hears it, something that has been the subject of growing debate among geriatric specialists, oncologists, and preventive medicine experts for the better part of 2 decades. Let us talk about routine cancer screenings that are still being performed on older Americans, even when the evidence supporting them for people in this age group has become deeply uncertain. Prostate cancer screening for men over 75 is the first place we need to stop and have a real conversation. A test, prostate-specific antigen, measures a protein in the blood that can sometimes indicate cancer. For decades, test was recommended almost universally for men of a certain age, and men lined up for it faithfully. As they should have, they loved their lives and they wanted to protect them. But here is what the research eventually uncovered. And what changed the way thoughtful physicians now approach this test in older men? Prostate cancer, particularly in men over 70, often extraordinarily slow growing. We are talking about a cancer that, in many cases, will never cause symptoms, will never spread, and will never shorten a man's life. It is what doctors call clinically insignificant cancer, which is a phrase that sounds almost impossible to believe because we have been taught our whole lives that cancer is always the enemy and must always be fought. But in an older man's body, particular enemy is often sleeping. And when a PSA test wakes it up, when it flags a number and sends a man down a road of biopsies, anxiety, anal testing, and potentially surgery or radiation, the treatment itself can cause serious harm. Incontinence, erectile dysfunction, infection, the complications of a biopsy. The psychological weight of a cancer diagnosis that may have never needed diagnosing at all. The United States Preventive Services Task Force, one of the most respected independent panels of medical experts in the country, concluded that for men aged 75 and older, the potential harms of routine PSA screening outweigh the benefits. That is not a fringe opinion. That is a careful data-driven conclusion drawn from years of evidence. And yet millions of older men are still getting this test every year. Sometimes because no one explained this to them. Sometimes because the doctor ordering it hasn't updated their practice. Sometimes because fear is a powerful thing and a test feels like control. I understand that. I genuinely do. When something is uncertain, when our mortality feels close, we reach for numbers and charts and results because they feel like certainty. They feel like ground under our feet, but false certainty. Certainty based on a test that may not serve you is not the same as safety. Now, let me tell you about something equally surprising that applies to women. Because this conversation is not only about men, and the second area we need to discuss carefully involves a screening that women have been encouraged to attend for years and years, sometimes right up to the end of their lives, without being fully informed of a critical nuance that changes everything after a certain age. Cervical cancer screening, specifically the Pap smear and HPV testing, has saved hundreds of thousands of lives. That is an undeniable truth, and it deserves to be honored. For women in their 20s, 30s, 40s, and 50s, screening has been one of the most powerful tools in preventive medicine. But here is what changes after the age of 65, and why many of the nation's leading women's health organizations now recommend stopping routine cervical cancer screening for women who have had 3 or more normal Pap smears in a row, consecutive negative HPV tests. Cervical cancer is caused by the human papillomavirus. It is a cancer that, when it develops, typically does so slowly over many years in women who have an active infection with certain high-risk strains of HPV. Women who have had normal screening results consistently and who are no longer in new sexual relationships where they might be exposed to new HPV strains, an extraordinarily low risk of developing cervical cancer in their later years. The biology of this cancer, the way it progresses, makes it essentially a disease of younger immune systems. The cervical cells of a woman in her late 60s or 70s, while they have changed, have done so in ways that are less likely to undergo the kind of malignant transformation that the Pap smear is designed to detect. But here is the cruel irony. Because the aging cervix does undergo normal cellular changes, becomes more likely to produce abnormal results on a Pap smear, not because cancer is forming, but simply because of age. And those abnormal results can trigger a cascade: colposcopies, biopsies, follow-up visits, anxiety, and procedures, all in pursuit of something that, in a woman of this age with a history of clean screenings, carries an extraordinarily low probability of being real cancer. The treatment of abnormal findings that would have resolved on their own or that represented no true threat causes real suffering, physical discomfort, fear that settles in the chest like a cold stone, sleepless nights, conversations with family members that change the emotional climate of a home. You deserve to know this. You deserve to walk into that exam room fully informed. You deserve to have a doctor who sits with you, looks at your history. Here is what the evidence tells us about your risk, and here is what I recommend for you specifically. Not a blanket order for the same test given to every patient regardless of age or history, but a thoughtful, individualized, evidence-based conversation. And now, just as you are beginning to feel the ground shift beneath what you thought you knew about medical testing, we need to talk about something that almost no one discusses openly with older patients. Something that sits at the intersection of heart health, longevity, and a quiet epidemic of overtreatment that has been affecting Americans over 65 for a generation. It involves your heart, and it involves a test that many of you may have already had or been recommended without fully understanding what finding something on that test might actually mean or cost you. Something important is waiting just around the corner of this conversation, and once you hear it, you will never look at your medical appointments the same way again. Let us stay with the heart for a moment. When it comes to the body you are living in right now, nothing commands more emotional attention than the heart. It is not just an organ. It is the seat of everything that has mattered in your life. Every person you have loved, every loss you have survived, every ordinary morning that turned into something extraordinary, all of it lived inside that beating, faithful muscle. So when a doctor suggests a test that might tell you something about your heart, you say yes immediately. Of course you do. How could you say anything else? Cardiac stress testing for low-risk, asymptomatic older adults is the third area where medicine has been slowly, carefully reconsidering its approach, and where the gap between what patients expect and what the evidence supports has become impossible to ignore. Let me explain what I mean, and let me do it in a way that treats you with the respect and intelligence you deserve. A cardiac stress test, sometimes called an exercise stress test or a treadmill test, measures how your heart responds to physical exertion. It has tremendous value in the right context. If you have chest pain, if you have shortness of breath that worries your doctor, if there are clear signs and symptoms suggesting your heart may be under strain. In those cases, a stress test is not just appropriate, it is essential, can be life-saving. Please hear that clearly. We are not talking about removing tests that are medically indicated. We are talking about something more specific and more nuanced than that. We are talking about routine, annual, semi-annual cardiac stress testing in older adults who have no symptoms, who have no history of heart disease, and who are considered low risk based on their overall health picture. And here is where the story gets complicated in a way that keeps cardiologists up at night. As the body ages, certain changes occur in the heart muscle, the vessels, the electrical system that are entirely normal, part of the natural evolution of a body that has been doing extraordinary work for 7 or more decades. Normal age. Related changes can produce what are called false positive results on a stress test. The test looks at the tracing, sees something that deviates from the baseline built for younger hearts, and flags it as potentially abnormal. Now that flag is on your chart. Now your doctor, acting with complete good intentions, follows up. You are sent for a nuclear stress test perhaps, or an echocardiogram, or in some cases, a cardiac catheterization, an invasive procedure that threads a thin tube through an artery into your heart to get a closer look. And cardiac catheterization, even when performed skillfully and carefully, carries its own risks. Bleeding, arterial damage, kidney stress from the contrast dye, and occasionally serious complications that land older patients in the hospital for reasons entirely unrelated to the original concern. All of this, remember, began with a routine screening on someone with no symptoms. A domino that fell not because something was wrong, but because a test designed for a younger heart read an older heart's normal variations as a warning. This is not medicine failing. Is medicine still in the process of becoming more sophisticated, more personalized, more honest about what aging actually looks like from the inside? And as a person over 65, you are living through that evolution. You deserve to benefit from what we are learning, not to be caught in the gap between what was once standard practice and what the evidence now supports. There is a principle in medicine that is quietly profound, and that older adults rarely hear stated plainly. It is this: is only useful if acting on its results will make you better off than not having had the test at all. That sounds obvious, but when you apply it rigorously to routine screenings in older populations, changes the calculus in ways that most patients have never been invited to consider. That leads to procedures carrying more risk than the condition being tested for does not protect you. It exposes you. Understanding that distinction is not pessimism. It is wisdom. It is the kind of wisdom that only comes when medicine stops being about doing more and starts being about doing what is right. Now I want to shift the conversation. There is something happening in this picture that goes beyond individual tests and touches something deeper about how older Americans are perceived and perceive themselves within the medical system. There is an unspoken assumption in American healthcare that more vigilance equals more safety. That if we screen for everything frequently and thoroughly, we will catch problems earlier and live longer, healthier lives. Assumption is not entirely wrong. For many conditions and in many age groups, early detection is genuinely life-saving. Is also not universally true, and the nuance between those two realities matters enormously when you are 65 or 75, 5 years old. Because at those ages, the risk-benefit calculation is genuinely different. Not because your life is worth less. Please hear me say that clearly and completely. Your life is not worth less. Your decades of experience, your relationships, your knowledge, your joy, these are irreplaceable. But the biology of your body at this stage of life is different in ways that change what screening can and cannot do for you. Your immune system responds differently. Your capacity to tolerate treatment has shifted. The timeline between finding something and that something causing harm is longer for many conditions. And the psychological weight of a diagnosis, the anxiety that settles in from the moment a doctor uses the word abnormal, can itself cause measurable harm to health. Elevated cortisol, disrupted sleep, social withdrawal, reduced appetite. The worry itself becomes a health condition. The fourth checkup I want to talk about is one that will genuinely surprise you. Because this one is not about cancer, and it is not about your heart. This one is about your brain. And in a culture that is terrified of cognitive decline, where the word Alzheimer's carries more fear than almost any other diagnosis, idea that certain brain-related screenings might do more harm than good feels almost heretical. But I am asking you to stay with me. What I am about to share is important, and it is deeply compassionate. Routine cognitive testing, the kind increasingly offered as part of annual wellness visits for seniors, the kind that scores your memory, your processing speed, your word recall, is not, in itself, harmful. In fact, for someone experiencing noticeable changes in their thinking, or for someone with a family history and specific risk factors, a thorough cognitive evaluation performed by a specialist is absolutely the right path. Understand that. We are not talking about ignoring symptoms. We are never, ever talking about that. What we are talking about is the quiet explosion of routine, standardized cognitive screening being offered to all older adults as a matter of course, without a clear pathway for what happens when the results come back showing the normal, expected variability of an aging brain and without a clear plan for what that person is supposed to do with the information. Here is what happens in too many cases. An older adult, perfectly functional in daily life, with a brain that is doing exactly what a healthy, aging brain does, takes a memory test during a routine appointment. Their score falls slightly below an arbitrary threshold, and suddenly that person, that vibrant, capable, fully functioning human being, has been handed a label, pre-dementia, mild cognitive impairment, a category that sounds clinical but lands in the heart like a sentence. And the research on what happens next is genuinely alarming. Studies have shown that receiving a diagnosis of mild cognitive impairment, even when the person is not, by clinical standards, impaired in any meaningful way, increases anxiety, depression, social withdrawal, and reduced physical activity. It changes how that person sees themselves. It changes how their family sees them. It changes the emotional texture of their daily life in ways that are real and lasting. And because cognitive health is intimately connected to emotional health, to physical activity, to social connection, to a sense of purpose, all the things that actually protect the aging brain, that diagnosis can, in some cases, accelerate the very decline the test was meant to prevent. This is the paradox no one talks about at the wellness desk. The very act of measuring fear, of making the abstract threat of cognitive decline into a number and a category and a chart entry, can become its own kind of harm, because the aging brain is not a failing brain. The aging brain is a changed brain, slower in some ways, yes, but more integrated, more experienced, more capable of wisdom and perspective and emotional regulation than it was at 30. The research on this is beautiful and surprising, something you deserve to hear. Neurologists like Dr. Claudia Kawas at UC Irvine have spent careers studying people who live well into their 90s and beyond with sharp, engaged minds, bone breath. And what her research consistently reveals is that the qualities that protect the aging brain are not found on a test. They are found in a life, in curiosity, in movement, in sleep, in meaning. So when a standardized cognitive screening is offered as a routine part of every senior wellness visit, without a clear indication, without a careful discussion of what finding something might mean and what options truly exist, it is worth asking whether that test is serving you or serving a system that conflates measurement with care. Not a cynical question. That is a deeply responsible one. You are allowed to ask it. You are allowed to sit across from your doctor and say, why are we doing this? What will we do with the results? And how will this information actually improve my life? Those are exactly the right questions, and a good doctor will welcome them. And now we arrive at something that I believe is the most important thread running through everything we have discussed, something that connects the PSA test and the pap smear and the cardiac stress test and the cognitive screening into a single, coherent truth about aging, about medicine, and about the extraordinary opportunity you have right now to reclaim your role in your own health. Because underneath all of these individual tests is a larger story about how we have been taught to think about our bodies after 65. And that story, I believe, needs to change. Not just for your sake, though your well-being matters deeply and completely, but for the sake of every older American who is navigating a medical system that has not yet fully caught up with the science of what healthy aging actually looks like. What comes next is where this story truly turns and where everything we have built together starts to become something you can use, something you can act on, and something that could genuinely change how you feel. Not just in the doctor's office, but every single day of the extraordinary life you are still living. Here is what I want you to carry with you from everything you have heard so far. Not fear, not doubt, not a reason to stop trusting your doctors or to stop showing up for your health. I want you to carry something far more valuable than any of that. I want you to carry a new kind of confidence. Confidence that comes from truly understanding your body, your age, and your choices. That confidence, the kind that lets you walk into an exam room as a partner rather than a passenger, is one of the most powerful medicines that exists. And yet, I realize that what we have discussed might stir something complicated inside you, because we have spent a lifetime being told that the system knows best, that compliance is safety, that the doctor's recommendation is the final word and the right thing to do is simply to follow it without too many questions. And if that is what you have been taught, if that is the relationship you have had with medicine for 30 or 40 years, then hearing all of this might feel a little destabilizing. It might feel like the ground is moving slightly beneath your feet. Good. Let it move. The ground was always meant to move towards something better. The truth is, doctors, the ones who wake up every morning genuinely devoted to the well-being of their patients, want you to ask questions, want you to understand why a test is being ordered and what will happen with the results. They want you to be an engaged, curious, thoughtful participant in your own care. And the doctors who don't want that, who find your questions inconvenient or presumptuous, who rush through appointments without making space for the kind of conversation your health deserves, that itself is information worth having about whether that particular relationship is truly serving you. So let us talk about what good medicine looks like for a person in their 60s, 70s, or 80s. This is not just a conversation about what to avoid. It is a conversation about what to choose, about what actually works, about the things that science has validated repeatedly and powerfully as the true engines of healthy aging. And they are not as exotic or expensive or complicated as the medical industry sometimes makes them seem. They are, in fact, deeply accessible. Some of them are free. All of them are within your reach. Let us start with something that has been called the closest thing to a miracle drug that medicine has ever discovered. Something that requires no prescription, no insurance approval, no waiting room, and no blood draw. Movement. Physical activity, the body in motion. I know you have heard this before. I want to share it with you in a way that goes past the familiar reminder and into the actual biology of what happens inside an older body when it moves. When you understand the mechanism, the motivation becomes something entirely different. It becomes awe. When you walk, when you swim, when you garden, when you dance slowly in your kitchen to a song you love, your muscles release molecules called myokines, are tiny signaling proteins that travel through your bloodstream like messengers, communicating with your brain, your immune cells, your fat tissue, your liver, and your heart. They reduce inflammation. They trigger the growth of new brain cells in the hippocampus, the memory center, in a process called neurogenesis that scientists once believed was impossible in the adult brain. They improve insulin sensitivity. They lower the resting level of stress hormones in your blood. They literally change the gene expression in your cells, turning off the genes associated with inflammation and turning on the genes associated with cellular repair and longevity. All of this from movement. All of this from the simple, ancient, profoundly human act of putting your body in motion, is what the research on older adults specifically has found in study after study that I want you to hold close. It is never too late. The brain of a 70-year-old who begins a regular walking program shows measurable increases in hippocampal volume within 6 months. The cardiovascular system of an 80-year-old who begins gentle resistance training shows improvements in arterial flexibility within 12 weeks. Immune system of a 65-year-old who takes up regular moderate exercise becomes, by multiple biological measures, functionally younger. Is not done. Not even close. It is waiting for your permission to heal. Now let us talk about something that sits at the intersection of food and medicine, and that in the last 10 years generated some of the most exciting research in the entire field of longevity science. We are talking about the relationship between what you eat and the biology of aging inside every one of the trillions of cells that make up the extraordinary, irreplaceable body you are living in right now. You may have heard the word inflammation. You may have heard it described as the root of most chronic diseases: heart disease, diabetes, Alzheimer's, arthritis, certain cancers. And that is essentially correct. Chronic, low-grade inflammation, the kind that simmers quietly in the body for years without producing obvious symptoms, is now understood to be one of the primary drivers of the aging process itself. Scientists even have a word for it: inflammaging. And the foods you eat 3 times a day, every day, are either feeding that inflammation or extinguishing it. The foods that protect the aging body are not surprising in their identity, they are often surprising in their power. Colorful vegetables. The deep purples and rich reds and bright oranges of beets, blueberries, red cabbage, sweet potatoes are loaded with polyphenols and anthocyanins, compounds that act as natural fire extinguishers inside the body, cooling inflammatory pathways and protecting the delicate inner lining of blood vessels. Olive oil, particularly the cold, pressed extra virgin variety, a compound called oleocanthal that works through the same biochemical pathway as anti-inflammatory medications without the side effects. Salmon, sardines, mackerel deliver EPA and DHA, forms of omega-3 fatty acids that the brain uses to build and maintain its own cellular structure, and that have been shown in clinical trials to reduce the risk of cognitive decline. And then there is something that might genuinely surprise you. Something that many older Americans have been told to limit or avoid, and that emerging research is rehabilitating with real enthusiasm. Beans and legumes, lentils, black beans, chickpeas, kidney beans, are among the most consistently associated foods with longevity in populations around the world. In the blue zones, the remarkable regions where people routinely live to 100 with their health and minds intact. Sardinia in Italy, Okinawa in Japan, the Nicoya Peninsula in Costa Rica, Loma Linda in California, Icaria in Greece, beans appear at nearly every meal. They are rich in fiber that feeds the beneficial bacteria in your gut. They contain plant proteins that support muscle maintenance without the inflammatory burden of excessive red meat. They deliver magnesium, potassium, nutrients that support heart health, nerve function, and cellular repair. They are humble, affordable, and extraordinary. The gut, by the way, is a place where some of the most revolutionary science of the last decade has been unfolding. Your gut contains approximately 38 trillion microbial organisms, bacteria, fungi, viruses, that together form an ecosystem called the microbiome. And that ecosystem communicates directly with your brain through what scientists call the gut-brain axis, a bidirectional highway of nerves, hormones, and immune signals that shapes your mood, your cognition, your immune function, and your inflammatory status. When the microbiome is diverse and healthy, produces compounds called short-chain fatty acids that strengthen the gut lining, reduce systemic inflammation, and even produce neurotransmitters, serotonin, dopamine, GABA, that regulate your emotional well-being. When it is damaged by poor diet, by overuse of antibiotics, by stress and loneliness, it produces signals that promote inflammation, increase anxiety, impair memory, and accelerate the biological processes of aging. This is why what you eat matters so deeply. Not just for your waistline, not just for your cholesterol number, but for the living ecosystem inside you that is, right now, contributing to every aspect of how you feel and how you age. Fermented foods, yogurt with live cultures, kimchi, sauerkraut, kefir, miso, are among the most powerful tools for nurturing that ecosystem. They introduce beneficial bacteria directly into the gut and have been shown in controlled trials to increase microbiome diversity and reduce inflammatory markers in the blood. And now I want to talk about something that I believe is undervalued, under-discussed, and perhaps the most important of all the tools available to a person navigating the second half of their life with intention and grace. Sleep, not just any sleep, but deep, restorative, neurologically protective sleep. Because what happens inside your brain while you sleep is not rest in the passive sense. It is one of the most biologically active, profoundly essential processes your body performs. During deep sleep, the stages of sleep that older adults often struggle most to reach, the brain activates a remarkable system called the glymphatic system. Think of it as the brain's own overnight cleaning crew. During deep sleep, cerebrospinal fluid flows through channels in the brain, flushing out metabolic waste products that accumulate during waking hours. Among the waste products the glymphatic system clears are beta, amyloid, and tau protein, the very substances that accumulate in the brains of people who develop Alzheimer's disease. Every night of good, deep sleep is, quite literally, a night of your brain cleaning itself. Every night of disrupted, shallow, or insufficient sleep is a night that cleaning does not fully happen. And over years and decades, accumulation of that unclean debris becomes its own kind of risk. So when a doctor asks an older patient about their sleep, truly asks deeply and carefully, it is not a courtesy question, is a diagnostic inquiry into one of the most important pillars of brain and body health that exists. And when sleep is disturbed, whether by sleep apnea, by anxiety, by the ache of arthritis, by the midnight trips to the bathroom that become more frequent with age, addressing those disruptions is not a quality of life nicety. It is serious preventive medicine. There is one more thing I want to leave you with, and it is perhaps the most human thing of all. Because throughout everything we have discussed today, the tests, the biology, the food, the movement, there has been an undercurrent that I want to name directly because it matters more than all of it, and it is something no test can measure. Connection, belonging, the sense of being known, valued, and woven into the lives of others. The research on social connection and longevity is among the most compelling in the entire field of aging science. A landmark study by Harvard researchers that followed over 700 adults for 80 years found that the quality of a person's relationships was the single most powerful predictor of health and happiness in old age, not cholesterol, not exercise frequency, not any biomarker or screening number. Relationships, the warmth and depth of human connection. Chronic loneliness, by contrast, produces physiological changes in the body that are measurable and serious. It elevates inflammatory markers. It disrupts sleep architecture. It impairs immune function. It activates the same stress pathways as physical pain. Former Surgeon General Dr. Vivek Murthy declared loneliness a public health epidemic in the United States, noting that its health consequences rival those of smoking 15 cigarettes a day. 15 cigarettes a day. That is what isolation costs the body. And yet older Americans are among the most socially isolated demographics in the country. Often after retirement removes the daily rhythms of workplace connection, after children have built their own lives elsewhere, after friends and partners have been lost to illness or time. This is not a problem that will be solved by another screening test. It will be solved by communities that create real space for older adults to matter, to contribute, to be seen. By families who understand that a phone call is not a substitute for presence. By individuals who choose, even when it is uncomfortable, even when the grief of loss makes the prospect of new connection feel almost impossible, to reach toward another human being anyway. You are not at the end of your story. You are deep inside it, in what can be, with the right knowledge, the right habits, and the right questions asked of the right people, one of the richest, most meaningful chapters of all. The body you are living in is not failing. changing. It is adapting. It is doing things that science is only beginning to understand and appreciate. And you, with what you now know, are more equipped than ever to work with it rather than against it. So the next time you sit in that waiting room, under those fluorescent lights, in that paper gown, I hope you feel something different than you did before. I hope you feel the quiet confidence of someone who understands what their body needs, what questions deserve answers, and what it truly means to take care of yourself with wisdom rather than just with compliance. Because that wisdom, earned through years of living, sharpened by honest information, and held with both courage and compassion, is the most powerful medicine of all. And it has been inside you all along.